today we are going to talk about the radius. Okay, so radius is the bone. I think you already know that this radius is located in our forearm. Radius is located in the forearm, and there are actually two bones of the forearm, radius and ulna. Okay, radius is the bone related to our thumb.
Yes,
so when you are in anatomical position, the thumb stays lateral. So that means radius is also a lateral bone.
Yes, sir.
And ulna, on the other hand, ulna is a medial bone. But today we are not focusing about ulna, we are mainly talking about the radius. And this radius is also takes part in the weight transmission of our upper limb. Whenever you lift some weight, that will be transmitted by the radius. This is why radius is the bone facing most of the fractures. Whenever a person is falling on outstretched hand, we call this kind of falling. Whenever this is our reflex, like this, that whenever you are falling, you are trying to support yourself with your hands. And whenever you are trying to support yourself with your hands, there is some pressure going to be put in this area. And as radius is supporting the weight, so that means the fracture will be in this part of the radius, means the distal part of radius. If you compare between these two areas of radius, this will be the proximal part and this will be the distal part of radius. So let me here draw our radius and let's look into some features from these joints. So this is actually the anterior view of radius. Okay, so first of all, we have this head. This is more or less how the radius looks like from the anterior view. Okay, and just like any other long bone, the radius has three parts. Just like any other long bone, radius has three parts. So the middle part must be the shaft, and superior and inferior we have two ends of radius. Superior end is called the proximal end because it is closer to our body, and inferior end is called the distal end. So these are the three parts of radius. This is the proximal end. This is the shaft in the middle. So shaft will be the longest part. The ends are just the extremities of the bone, or the just extreme areas or these end locations of the bone. So they are just some small areas, but shaft will be the longest areas. And this is the distal end of radius. Okay. So first let's describe about the proximal end. Okay. In the proximal end, you can see a coin-like structure. So we are just looking from the front. This is why it looks like this. But if you look from all other views, you will see this thing just looks like a coin or just like a tablet. This tablet people take for illness, just like this tablet. And wherever there is a head located, you can find a neck. Okay, so in the proximal end, the main features are this head of the radius, the neck of the radius, and also there is a tuberosity in our radius. In the proximal end of the radius, you can find a tuberosity. So tuberosity is a muscle attachment site. Wherever a muscle will attach in a bone, we call that either tubercle, tuberosity, or trochanter. Okay. So in most of the bones, it is called tuberosity, and radius also has a tuberosity. So these will be the tuberosity of radius. So this is called the radial tuberosity. Okay, so let's discuss about some detail about these three features of the proximal end of radius. The proximal end of the radius, till now we have got three features: the head, the neck, and the radial tuberosity. Okay. So first of all, the head. Head is the part of radius which is going to form the joints of radius. And superiorly or proximally, radius actually takes part in the formation of two joints. First of all, your elbow joint, the joint between the humerus and the head of the radius. Okay, so if this is the radius, if this black portion of this marker is the head of the radius, on the superior area, on the top portion, it will form that elbow joint. It will take part in the formation of elbow joint, and it will join with the capitulum of humerus. The top portion of our head of the radius will join with the capitulum of humerus. So this is one joint. This is the first joint. But here is also going to take part in the formation of another joint, the joint between our radius and ulna. Because you know, when we do like this supination and pronation, these movements are going to happen in between our radius and ulna. So in between radius and ulna, we have two joints, two bony joints. One is proximal radioulnar joint, another is distal radioulnar joint. Both of these joints is in between some head and some notch.
Yes, sir.
Okay, so this proximal joint is in between the head of the radius and there will be notch in our ulna. That notch is also called a radial notch. So the first joint, the head is going to take part is in the elbow joint. Elbow joint is in between the capitulum and head of the radius. And second joint is proximal radioulnar joint. It is in between the head of the radius and radial notch of ulna.